Good afternoon. The topic for today's presentation is Unveiling the Diversity, a comprehensive review of herpes simplex virus. So starting with the introduction, herpetic oral ulcers in the oral cavity are mostly caused by HSV type 1 virus. It actually starts with the prodrome of symptoms like fever, loss of appetite, and it heals within a week on its own. So here I present 3 different cases on 3 different age groups. So going on to the case series, case 1. A 16-year-old female patient presents with the chief complaint of bleeding while brushing and touching the teeth for the past 4 days. She also gives history of fever. On external examination, there was a well-defined ulcer of size 1 and 1 centimeter with crustaceans. On internal examination, there was generalized erythematous marginal gingiva in both upper and lower arch. So we came to diagnosis as primary hepatic gingival stomatitis, and treatment plan includes syrup Zovirax 200 mg along with mouthwash Cholera. Patient has to report after 5 days for review. On follow-up, there was complete healing of the ulcer and reduction in pain. So moving on to the second case, a 63-year-old male patient came with a chief complaint of soreness in his lower legs for the past 4 days. Patient also gives history of fever and tingling sensation along with itching. Patient also gives history of diabetes and smoking. On external examination, there was an ill-defined solitary ulcer of size 1 and 2 cm located in the lower lip. On palpation, there was tenderness and roughness. So we have evaluated the patient by using smear for exfoliative cytology and HSV titer were done. On the results, there was T and cells were evident, suggestive of HSV virus. On HSV titer, there is increase in IgG antibodies suggestive of chronic infection. So we came to a diagnosis of herpes radialis in relation to lower lips. As the lesion is localized, we have started the treatment with topical medication. So the treatment plan includes topical acyclovir 5%, 5 times a day for 2 weeks, and supplementary treatment includes adequate fluid intake with diet modifications. So the follow-up picture shows complete healing of the ulcers along with reduction in the pain. So moving on to the third case, a 22-year-old male patient came with a chief complaint of pain in the mouth for the past 4 days. He also gives history of fever, and he also complains of recurrent ulcers, which is association with stress. So on examining the labial mucosa, there was multiple ulcers of size 0.5 into 0.5 cm in the lower labial mucosa. On the tongue, there was blood-tinged ulcers. So we have done cytological smear and HSV titer for this patient. It also shows T cells suggestive of HSV infection. On examining the HSV titer, there was increase in IgM antibodies suggestive of acute infection. So we came to a conclusion of recurrent intraoral herpetic ulcers in relation to right and left tongue and labial mucosa. As the ulcers are widespread and chronic, we have started the systemic antiviral drugs. We started with tablet acyclovir 400 mg thrice a day for a week. Symptomatic management include syrup mucin gel, and supplementary management include tablet Zincovit for 30 days and adequate hydration and stress management were taught to them. So on review, there was complete reduction in the symptoms and the ulcers were healed. So analyzing these different cases, this chart represents these 3 cases arises in different age groups and different genders. These 3 lesions arise in uncommon areas with similar symptoms. So this is the comparative chart of the 3 ulcers. So primary hepatic gingival stomatitis commonly occur in children and teenagers, and hepatic labialis and recurrent ulcers arises in young adults. It commonly arises in male, and the sites were keratinized and non-keratinized mucosa in primary hepatic gingival stomatitis and keratinized mucosa in herpes labialis and recurrent ulcers. All the ulcers are small and round in shape, mostly occurs as multiple ulcers. The symptoms were similar like fever, malaise, burning, and itching and tingling sensation. Mostly associated with fever, and recurrent ulcers are associated with stress and menstruation. So the literature review shows that the etiology for most of the disease is viral infection along with stress, and the epidemiology report shows that 60 to 90% of the population are usually affected by HSV1. They may not experience in the primary infection, but the latency of the virus can influence the secondary infection. So the symptoms are almost similar in all the 3 cases, like burning, itching, fever. So the evaluation of the herpes can be done by using HSV titer. But the gold standard for this is viral culture. Direct immunofluorescence and seroconversion test can also be done. So this is studies based, for evaluating the gender prevalence. It was conducted in Canty. It shows that males are more prevalent for HSV type of virus and HSV type of virus, and the titers were well evaluated during the 5th and 7th day.